Welcome to this video on the prevention of RSV. First, let me introduce myself. My name is Lieke de Frankrijker and I am a pediatric infectious disease specialist working at the Wilhelmina Children's Hospital in Utrecht in the Netherlands. I did a PhD on the interaction between RSV and bacteria, especially in cystic fibrosis patients. Other than working as a doctor, I'm also a mother. These are my twins, Seth and Jonas. They were born prematurely, but now at the age of 6.5, they are almost as tall as I am. So first we'll talk about the spread of RSV, because RSV is highly contagious. How does it spread? Mostly RSV will spread via droplets, and these droplets are created when somebody coughs or sneezes or even when they speak. And when people touch the droplets, they can transmit the virus through, for instance, their hands, to their noses or to mouths. We also know that the virus can remain active on surfaces for up to 7 hours. So, for instance, on tabletops or doorknobs. Next, we'll talk about measures to reduce the risk of getting infected with RSV. It is never entirely possible to completely rule out the chance of getting infected with RSV, but fortunately there are several things that we can do to reduce the risk of getting infected. First of all, it's important to sneeze or cough into your elbow and to wash your hands frequently. Like I told you before, the virus will spread through droplets, and these are spread through people's hands. Also, it's important to avoid any contact with sick people. So, for instance, if you have a young baby at home and a person wants to come and visit, but they are sick, so they have signs of a possible respiratory infection, it is best to postpone their visit until they are well. And then finally, it's important to clean objects, for instance, toys or tabletops, frequently, because we know that the virus can remain active on surfaces for up to 7 hours. So in conclusion, you can take preventive measures to reduce the chance of getting an RSV infection. So that is by keeping the baby away from people with a cold, and to only touching the baby after you've washed your hands, to not smoke near the baby, and if possible, to choose breastfeeding over bottle feeding. I would also like to include this quote from Rachel Thomas, who is a member of the Patient Advisory Board at the ResVNet RSV Patient Network. And she said a very important thing. She said, sometimes distance is the kindest gift you can give your loved one if you are ill. So not hugging the cute baby or your beloved grandparent when you just have a cold. Sometimes caring is not sharing. Very powerful and very true. Fortunately, there are also preventive products which have been developed in the past years. So we now have 2 immunization products for infants, and we have the maternal vaccine. For infants, we have the monoclonal antibodies, and we have the RSV vaccine for adults over 60 years. And all these prevention products will offer protection from a severe RSV infection. So first of all, the maternal vaccination. The vaccine can be given to the pregnant mother during the late 2nd or 3rd trimester. And by administering the vaccine to the pregnant mother, the mother will make antibodies against the virus, and the antibodies will be transferred through the placenta to the unborn baby. And with this, the baby will be protected against a severe RSV infection during the first 5 to 6 months of life, which are also the most vulnerable months for these young babies to be getting a severe RSV infection. So for the infants, we have the monoclonal antibodies. These antibodies can be used directly after birth to immunize the babies. And by giving them 1 dose, they will be protected from a severe RSV infection for at least 5 months. There's also a vaccine for older adults over 60 years of age. This vaccine can be administered during the RSV season and will offer protection for at least 6 months. Thanks for your attention.